He screamed that I was faking in a hospital waiting room. The attending physician had just walked in. I have a connective tissue disorder that makes my joints unstable in ways that are invisible until they are suddenly and dramatically not invisible. On a good day, I look entirely healthy. On a bad day, I am managing pain that would send most people directly to an emergency room while standing upright and functioning and being told by strangers that I seem fine. My former stepfather, Leonard, had formed his opinion of my condition early and maintained it with the stubbornness of a man who had decided that medicine was largely a transaction between anxious people and opportunistic doctors. He used the word psychosomatic the way people use words they have recently learned, frequently and with misplaced confidence. The waiting room incident happened 2 years after my mother's divorce from him. I had gone alone to a large public hospital during a dislocation episode, significant enough that driving myself had been inadvisable. I was sitting with my left shoulder immobilized in a position anyone with basic anatomical awareness would recognize as not voluntary, filling out intake paperwork with my right hand. Leonard walked in 17 minutes after I arrived. He saw me across the waiting room, and his face moved through recognition and then through the particular satisfaction of a man who believes he is about to be proven correct about something. He sat down 2 seats away, uninvited. He said, loudly enough for surrounding seats to register, that it was remarkable how my mysterious condition always produced symptoms in public places where people could observe them. He said he had done considerable reading and that the category of illness I claimed to have was disproportionately self-reported by people who found it socially useful. He said the kindest thing anyone could do was stop providing the attention the symptoms were designed to generate. The woman sitting quietly to my left stood up. She was perhaps 50, wearing dark trousers and a lanyard I had not paid attention to until she stood and it became visible. She introduced herself by name and department. She was an attending physician in the rheumatology unit, present in the waiting room to escort an elderly patient upstairs. She told Leonard that she had been sitting adjacent to me for 11 minutes and had observed my presentation on arrival. She said what she was looking at was a clinical presentation consistent with acute joint dislocation in a patient with a known hypermobility disorder. She said the suggestion that I was performing this for social benefit was not only incorrect, but represented exactly the dismissal that caused patients with connective tissue disorders to delay seeking treatment until their conditions became significantly harder to manage. She then looked at me and said she was letting the front desk know I should be triaged ahead of the current queue. She asked if there was anything I needed while I waited. I said I would appreciate something to rest my arm against. She sourced a pillow from the nurse's station herself and adjusted it under my arm with the matter-of-fact efficiency of someone for whom helping is simply the default setting. Leonard sat in the particular stillness of a man who has been corrected comprehensively in front of an audience and has not yet identified his next move. He was called to a different window shortly afterward, and I did not watch him go. I was seen within 20 minutes. The dislocation was confirmed, managed, and documented. The attending physician stopped by the treatment bay briefly before the end of her shift to check on the outcome, which I have always considered an act of human decency so complete it requires no further embellishment. I have not seen Leonard since. He exists in a category of people I have stopped allocating square footage to in my thinking. My shoulder healed. My condition continues to be exactly as real as it has always been. Some days I look entirely fine. I have stopped explaining the difference.